My name is Dr. Kael Murphy, and I'm a board-certified OBGYN with the St. Luke's Medical Group at West County Women's Healthcare. I earned my medical degree from Creighton University in Omaha, Nebraska, and I just completed my residency at Mercy St. Louis in OBGYN. I chose to work in obstetrics and gynecology after my first clerkship rotation in medical school. I attended delivery, and after that I thought that there was no cooler, more fascinating, or more beautiful experience, and I decided that's what I wanted to do every day for forever. I chose to work at St. Luke's because when I was interviewing it, I'd met a group of doctors who had the same care philosophy that I did, and I also liked the close personal contact that the administrative side of St. Luke's offered me. I also specialize in preconception, prenatal, and postpartum care, and I have a special interest in adolescent and pediatric medicine. My care philosophy is to take the entire person into account when making a diagnosis, because oftentimes medicine is far more complex than just the complaint the patient presented with, and I think it's important to know the full story before jumping to a conclusion or a treatment. I use the American College of Obstetrics and Gynecology recommendations in support of my stance on preventative medicine screenings, including pap smears and mammograms. I use this evidence to offer my recommendations to patients in regards to what screenings they should consider, and then the decision to proceed is determined based on a discussion between me and my patients, and it's ultimately their decision if they want to move forward with the recommendations. The most common question or topic that I get asked is about birth control usually. Patients either often want to start birth control, switch types of birth control, and I've had this discussion so much that I have a chart that I use that breaks down each type of birth control and its overall efficacy, and I have found that really helpful with this common question. The first thing someone should do to prepare when deciding to start a family is take a prenatal vitamin. I recommend this 1 to 3 months before even getting pregnant. This will help both with first trimester nausea in the mom and also help with brain and spine development in the baby. A fun fact about me is during the summer in college, I had an internship at the St. Louis Zoo working in reproductive and endocrinology, which meant I collected lab results and did pregnancy tests on animals. In my spare time, I like to work on house, yard, garden projects, cook with my husband, and we like to spend time with our family and friends.